Hi, I'm Kimberly Brown, and I'm doing this presentation to fulfill the requirements of Research 415 signature assignment at Aspen University. This presentation is about music therapy as an adjunct therapy for patient recovery. At first, my clinical problem was very narrow, as I was trying to put music therapy in a box and only say that music therapy should be used for pain management. But the more I learned about music therapy, the more I began to realize that music therapy cannot be limited in its potential. Music therapy can be used for pain management, patients with aphasia, children, women, men of all ages, and even the unborn. Research on music therapy is extensive and convincing. Dr. DeFlora Lane is a music therapist working at the University Hospital's Case Management Clinic in Cleveland, Ohio, which is associated with the University Hospital's Stedman Cancer Center, established in 1866. This hospital was keeping the body of a young woman alive because of her unborn child. The woman was brain dead due to an injury, and the intensive care nurse referred the patient to the music department to see if something can be done to help the baby, since the baby was not getting any stimulation from the mother. Let's see how the baby responded to the music therapy.
When I was walking into the intensive care unit, I did not know what to expect. And when I pulled the curtain back, my legs were wobbling. I walked over to her bed, and I saw this little lump in the middle of her belly. And I just gently placed my hands right over that little lump. And I began to sing. He's got the whole world in his hands. He's got the tiny little baby in his hand. And that baby began to dance under my fingers. I felt little knees and elbows rolling. I felt stretching. So I walked a little bit closer, and I sang a little louder and a little faster. This old man, he played too, he played knick-knack. And that baby's movements increased, and the heart rate went up. And I thought, life on the inside, responding to music on the outside.
Operationalize and change clinical practice. I would like for the nurses and the healthcare providers at this hospital to start referring patients for music therapy. If you have a patient and you believe that they can benefit from music therapy to improve their recovery in whatever realm, whether it is a brain injury, depression, movement, refer them for music therapy. Music therapy has been proven to work, and it is evidence-based. Theoretical models using music therapy as an adjunct treatment for patient recovery can be seen at the University Hospital Stedman Cancer Center. They have a whole music therapist department with a whole equipment and everything. Barriers I can see to implementing this policy is not knowing the benefits of music therapy. Music therapy is an evidence-based practice that offers client-centered care. Music therapy is an accredited profession and has been accredited since 1950. There are over 70 colleges and universities that offers this degree. A music therapist are individuals that have completed the education and the clinical training requirements established by the American Music Therapy Association, and they hold a current board certification from the Certification Board for Music Therapists. Music therapy is currently being offered in hospice, pain clinics, the prison, veterans in the VA, school systems, and nursing homes, and in hospitals. So we're kind of behind the curve in getting this thing started, but we want to go ahead and move this initiative forward and if you have a patient that you believe can benefit from music therapy, by all means refer them for music therapy. Internal evidence demonstrating improvements in patient outcomes can be seen at the Sedman Cancer Center at the University Hospitals in Cleveland, Ohio. The healing power of music can be seen in this next clip. It's a clip about Mr. Z. The surgeon referred Mr. Z for coping to the music therapy department. Mr. Z was a previous doo-wop singer, and he was in the center because he had to have a laryngectomy. After his surgery and his recovery, he did fine, and on the day of his discharge, Dr. Lane went into his room and she captured his response to one of his favorite Broadway tunes. See clip.
We built a rapport that was out of this world, and we redeemed the time and sang as much as we could prior to his surgery. And then the day he went into surgery, he said, "Euphoria, after this is over, you and I work together to see what can be done with music therapy with people like me." And I said, "I sure will." And subsequently, we did. The day he came out of surgery, and prior to his discharge, the intern and I talked about what we could do. And so on that day that he was to be released, we went into his room and we captured his response to one of his favorite Broadway tunes. Start spreading the news. I believe in today. I know I want to be a part of it. New York, it's up to you. New York, New York. Awesome. Awesome. You make it awesome.
Music stimulates the brain to release endorphins and serotonin, which has an express effect on our emotions and our mood. The music that individuals like the most is the music that they will be most responsive to, according to literature. To illustrate this principle, Mr. M, another patient at this facility, was suffering from expressive aphasia due to having a stroke. Dr. Lane used a technique called therapeutic singing, which entails singing a song that the patient is familiar with and likes, and leaving out certain words with the hope that they would fill in those words. See the before and after clip here.
Watch his mouth.
As you can see, new neural pathways were created in the brain that had damaged pathways. The techniques of music therapy promote new neural pathways and they circumvent damaged areas in the brain, creating new routes, enabling people to speak and to sing. Music therapy has been proven to reduce pain, decrease anxiety, withdrawal, depression, improve speech and language rehabilitation, improve physical and motor rehabilitation, increase respiratory capabilities, facilitate expressions of feelings, create hope, and increase socialization by elevating a person's mood. I'm not aware of any ethical issues regarding music therapy. Dr. Lane thought it would be contraindicated with people who were singers due to losing that ability and then being reminded of what they couldn't do. But she was wrong. She noticed that the Broadway singer, it was not contraindicated. It actually elevated his mood. Finally, after hearing this presentation, I implore you to refer your patients for music therapy to improve their recovery. The hospital administrator have already approved hiring a music therapist because music therapist has been proven to increase patient outcomes and reduce hospital time. Further, healthcare professionals that have witnessed music therapy in session with their patients have reported feeling more calm, relaxed, and satisfied due to seeing the improvement of their patients. Thank you.